We'll do the legs. Start here from the abdominal aorta. Remember, this is the descending aorta, but we call this the thoracic aorta. It's behind the heart. This is the abdominal aorta. When you come down to here, it's going to split into the iliacs. Remember, this is the ilium here of the os coxa. So this is the common iliac artery and vein. Internal iliac, external iliac. Remember, and the blues are just the veins. External iliac vein, internal iliac vein, common iliac vein. When you go here, the external iliac vein artery becomes the femoral artery because it's next to the diaphysis of the femur. When you go behind the knee, this is the popliteal artery. When you come here, you have the posterior tibial artery and the anterior tibial artery, because that's the tibia. And then here is the pedis dorsalis artery. When you look on this side, on this one, the same thing, anterior tibial artery. This is the tibia. This is the great or greater saphenous vein. This here is the femoral artery and the femoral vein. This is the deep femoral artery and deep femoral vein, and you don't need to know this. So you need to know everything medial to the femur. When you come up here, or we'll do the thorax, you have the superior vena cava and the inferior vena cava, both dumping into the right atrium. You should also see opening from the coronary sinus. It goes to the tricuspid valve, the right ventricle, the pulmonary valve, the pulmonary trunk, the left pulmonary artery. The right pulmonary artery, it's kind of hard to see because it's hid behind here. And then here are the pulmonary capillaries. Realize that the blue are the pulmonary arteries, the red are the pulmonary veins. Remember, it's switched in the pulmonary. So, oxygenated blood goes in the right and left pulmonary veins. In here, they come back to the left atrium, bicuspid valve, left ventricle, into the aortic valve, which is right there. And then it's going to go up the ascending aorta, the aortic arch, and then it's going to split off. When you split off, you've got three parts: brachiocephalic trunk, left common carotid artery, and left subclavian artery. Those are the three things that come off. Make sure you check your book for that. When you go back down to here in the abdomen, this is the diaphragm. Just to make sure you know which organs are here. This is the liver on the right. The stomach is here, but it's missing. This is the spleen, dark red, because a lot of blood goes in there, and these are the two kidneys. So the kidneys are renal. This is the right and the left. Renal artery, renal vein. When you look at the liver, think of hepatitis. This is called the common hepatic artery, and these two are the hepatic veins. This is called common hepatic because it's going to split into many areas, but the veins don't have the common. They just go straight in. Here, this one that comes up is the left gastric artery. Gastric, think about it for the stomach when you have gastric problems, right? This is the spleen, so this is splenic artery with one E, splenic artery. And right here, which goes down, that is the superior mesenteric artery. Mesenteries refer to the intestines. If you look a little further, this thing is the inferior mesenteric arteries. So from here and here, you have all the intestines right here. So you have some from the bottom, some from the top that get the blood supply. Superior mesenteric artery, inferior mesenteric artery. Where this four-way intersection is, right there, is called the celiac trunk. C-E-L-I-A-C. When you go down further, there are two things that squiggle down. These are called the gonadal arteries. They do not go to the legs, but they either go to the testes, which would be down here, or the ovaries, which are up here. Okay.